Thank you so much. And oftentimes, people believe the hallmark of this administration is going to be our pursuit for public safety. But I think it's just one of them. I think the most significant impact we are going to make is around health. Health is crucial. I talk about it so much that my family no longer wants to sit down at Thanksgiving time with me because I just believe that proactive health care is just so important. And as our chief housing officer stated, that we have assembled together those people who have worked for so long around these important issues such as health care and housing. And it was unbelievable when we started to do our analysis that we witnessed the disconnect. It was no secret that people who are on our streets dealing with mental health illnesses and other chronic diseases, they were basically coming into the emergency room, using it as their primary care, and we were turning them back out into the street only to have them return again a few weeks, and in some cases a few days later. It just made no sense. It was feeding the healthcare crisis. It was just creating the economic instability that comes with a failing healthcare system, and to connect the housing with and near hospitals is just such a giant leap forward. And we could not do it alone. If we were asking Dr. Katz to do this by himself, it was just not the right thing to do. It was an unfair thing to do. So we brought the team together, and we used all of the resources and assets that can make this happen. H&H does not sell land, but they have land. And by partnering with DSS, partnering with all of the advocates and all the resources we had available, we turned in this beautiful building, and it is a beautiful building, into a place that people can move and cycle into permanent housing. And so the whole initiative, Housing for Health, if you have a home to go to, you could take your medicine on time. You could follow up on your response to your doctors. You can use telemedicine to visit and speak to your doctor for mental health issues as well as health issues. You begin to start the process of having stability. The numbers are clear. If you don't have a permanent house, you are several times more likely to have to go to the emergency room. This is foundationally just wrong. We've ignored it for far too long. And this administration, we're going to look at those problems that have been ignored and continue to magnify because they're not responded to correctly. And it's not easy because we're pushing against the norm. We're pushing against the whole concept of let's just pretend as though it doesn't exist. We say it does exist, from homelessness to crime, to health care, to education. These are challenging issues that we are willing to face, and we're willing to face head on. Housing for Health is a holistic approach to dealing with health care. Health care is a full body approach, and we must attack the problem holistically. And we pointed this out as part of our housing blueprint. And the goal today is to partner with Health and Hospital, and we converting an unutilized building here, but unutilized city property on our hospital campuses. You visit hospitals and you notice that there is just so much land that's available, yet we have so much that is needed to build housing, and to not match the two together is just a failing policy and process. And so since January 2020, we have placed more than 1,000 patients into permanent housing and medical respite beds, and this initiative is going to look to bring an additional 650, and that's only the beginning. We're going to be looking at other locations to make sure that we are fixing a problem and not kicking the problem, the proverbial problem of the can down the road. So I'm really proud to be here. This is a major part of our agenda and initiative. Housing for Health provides a roadmap for the future, something that's going to be duplicated, I believe, all over this country. And to all those involved, the visionaries, those who have executed, and all of our partners who are sitting here in the audience, part of the various agencies that believed in this plan, thank you so much. We took a vision and made it an actual realization for so many families. And I believe it's going to have a major impact on our health systems. Thank you so much.